All right. First of all, I want to thank everyone for joining us um, today for the Survivors Table Nutrition Tips for Reducing Cancer Recurrence. I am Amy Hanley. I'm the program director for the Alliance, and I'll be walking you through a few housekeeping items before we begin today's webinar. This webinar will be a short presentation. We received several questions from the audience. And we've worked to add those and answer them into the presentation. If you have additional questions, please add them to the Q&A box and send to all participants, and we will try to get to these as time allows. All lines are muted for noise reduction, and the presentation is being recorded and will be available on the Alliance's website, through our YouTube channel, and will also be shared via our social media channels. Finally, if you have any questions about this event or any of the Alliance's future events, please contact me at the email listed here. So before we begin, I just want to reiterate for anyone who doesn't know, the Abdominal Cancers Alliance is an independent nonprofit connecting and empowering the abdominal cancer community to see that every patient receives appropriate and timely care throughout their cancer journey. We work to connect the larger abdominal cancer community to patients and resources to ensure we save and improve lives. And we do this through three means: by raising awareness with the public and care providers, making connections to resources and care, and guiding patients and caregivers throughout the cancer journey. The Alliance has established a central information system of resources on abdominal cancers and treatment options. And I just want to touch base on some of those resources now. In addition to our resources about abdominal cancers and recently diagnosed guides, we also have information on treatment such as CRS and HIPEC, and survivorship resources such as our recent resource on nutrition. Many of these topics will be covered or discussed today, but you can find additional resources through our website and also at this QR code. And now I want to introduce you to today's speakers. First, we have Lisa Davis. Lisa is a certified nutrition specialist with a PhD in nutrition from Johns Hopkins Bloomberg School of Public Health. She has expertise in obesity, weight management, diabetes education, and prevention of obesity-related comorbidities. She is also an internal medicine physician assistant by training and currently works at Mercy Medical Center's population healthcare team, where her focus is internal medicine, diabetes, weight management among underserved populations. She has extensive history in clinical nutrition research and has authored several research articles and co-authored an anti-inflammatory cookbook, as well as served as vice president of scientific and clinical affairs in a major weight loss company, chief nutrition officer in a healthy meal delivery business, and has strategically developed numerous personalized preventative health products and programs. Next up is Dr. Lawrence Cheskin. His career has been dedicated to research, education, and program building in the service of combating obesity through both treatment and prevention. His body of work is at the intersection of public health and clinical medicine because it applies knowledge gained through rigorous clinical investigation. He's played a key role in several clinical trials. His work has impacted the problem of obesity through innovative treatment paradigms disseminated through practice. And it was modeled by the Johns Hopkins Weight Management Center, which was founded in 1990 and has been directed by him since. Through application of new treatments and community-based participatory research, particularly among the underserved in Baltimore, Maryland, through teaching and mentoring of next generation of public health and clinical scholars dedicated to obesity, and through a key role as associate director of the NIH U54 funded Global Obesity Prevention Center at Johns Hopkins. He is also principal investigator of its pilot studies and core. And so with that, all right, Larry, why don't you go ahead?
Great. Well, thank you, Amy. and Bo for inviting us. I wanted to start off by talking about how, in fact, the survival rate for cancers has really improved over the past 20 years. The 5 year survival rate, and we wish it were 100%, but it isn't 100% even for people without cancer. The 5 year survival rate is now about 68%, more than two-thirds. And there are always important things that are in our control and things that are not in our control. So, bad luck is not in our control. What is in our control is what we eat, whether we're physically active, and what our body mass index or risk of obesity is. And that will influence the rate of recurrence and overall survival after a cancer diagnosis. And what we want to do, of course, is provide evidence-based, cancer-specific recommendations in those areas for reducing your risk of recurrence. Next slide, please. So, being a cancer survivor comes with certain costs. And believe it or not, some of these things are obvious and some of them are not so obvious. You can, and you're at a higher risk of getting a secondary cancer. And this is not just recurrence of the original cancer, but a new cancer. You're also at greater risk of osteoporosis, bone thinning, a greater risk of obesity, and this should be understood as something that increases the risk even before you got cancer. So some of you were at a higher risk for cancer because of initial weight increases. It's also a risk factor for recurrence of the cancer after it has been diagnosed and treated. Also, an increased risk for heart disease, type 2 diabetes, the old adult onset type diabetes, and things like ability to perform your activities of daily living can be impaired in cancer survivors because of the consequences of the cancer and its treatment. Next slide, please. Um, the prevention triangle, it's sometimes referred to, is the combination and intersection of diet, physical activity, and a healthy weight. These are all modifiable, which means your actions or inactions will influence whether they happen or not, and it will therefore influence the risk of recurrence of your cancer and your overall survival. So you want to clearly be in that 68% that are going to make it at least 5 years, and in the percent that make it well past that point. Next slide, please. So I should add to the list of diet, healthy weight, and exercise, drinking. We know, and it's becoming increasingly clear, that there is probably no safe level of alcohol consumption when it comes to risk and recurrence of cancer. There are 6 types of cancer that are particularly linked to alcohol, and those include liver cancer, hepatocellular cancer, another term for that, colorectal cancer, cancer of the mouth, and upper respiratory tract, cancer of the esophagus, and breast cancer. It is also linked to risk of heart disease, drinking, as well as risk of obesity and chronic liver disease like cirrhosis and something we used to call fatty liver disease. Next slide, please. Most of the research about healthy weights and cancer has been done in breast cancer survivors, both because it is a very common cancer, number one, for women, of course, as well as one that has been studied a great deal for many years. Um, and so we know about breast cancer survivors and the effects of obesity, physical activity, diet, and alcohol on survival, recurrence of cancer, and the risk of secondary primary cancers, in other words, different cancers than the initial breast cancer. Um, uh, the bottom line, I guess you could say, is that women who had a BMI greater than 30, which is the cut point for obesity, and we're talking about majority at this point of adult women in the United States, did have a higher risk of recurrence of breast cancer and mortality. This is not just true of breast cancer, however, it is very likely true for virtually all other cancers. And the mechanism for that, the reason for that, is because our fat tissue is inflammatory. And Dr. Davis will talk to you more about how you can have an anti-inflammatory diet. Fatty tissue is also hormonally active. It produces sex hormones, estrogen, progesterone, and others. So these are potential carcinogens. So having more fat is effectively carcinogenic. This illustration shows the cancers of the digestive tract and related organs like the pancreas that are affected by excess body weight, as well as endocrine related cancers, bone cancers like myeloma, cancers of the female reproductive system, like not just breast, but ovarian and endometrial cancers, and for men, cancer of the prostate. There are a variety of hormonal modulators that include not just inflammatory molecules, but growth factors, adipokines and leptin, you may have heard of, that are stimulants to weight gain, fatty acids and their breakdown products, steroids and steroid hormones like estrogens and glucocorticoids are also increased in those who have extra body weight. Next slide, please. So just to review what the cut points are for weights that are desirable and less desirable. The normal body mass index, and if you don't know your BMI, you can search online for BMI calculator. There are lots of websites that have that you plug in your height in inches and your weight in pounds, and it will tell you this kilograms per meter squared. It's a metric unit, so it's not that inherently obvious, the numbers for us. But normal body weight is 18.5 to 25 kilograms per meter squared. So it adjusts your weight for your height. Weight in kilograms or pounds divided by the square of your height in meters or inches, depending on the formula that is used to do the translation. And why is it the square of your height? Well, we're three-dimensional beings, so that you can't just divide your weight by your height, because your height makes your body mass go up by the square of the height, because it's a three-dimensional measure. Overweight, and we've got probably 70% of the US adult population in this category or heavier. The cut points are 25 to up to, but not including 30 kilograms per meter squared of height. Obesity is 30 to 40 kilograms per meter squared. And we have different grades of obesity, we call them, or classes of obesity, class 1, 2, or 3, whether you're 30 to 35 or 35 to 40, or class grade 3 is used to be called morbid obesity. That's no longer politically correct, so we call it serious obesity, and that's a BMI of 40 kilograms per meter squared or higher. Um, the risks start to increase in the overweight range, but they're pretty modest, the increased risk, until you get into the obese, and certainly are major increases in risk of cancer and their recurrence when you are in the severely obese class 3 obesity range of greater than 40 kilograms per meter square. Just to ballpark it, if you're more than 100 pounds overweight, you're in that severely obese category, or if you're double you're at what we used to call ideal body weight, you're going to be in that severely obese category. Next slide, please. So, where the fat in our bodies is located is actually also very important. Um, Probably more so for heart disease and diabetes than it is for cancer, but for cancer and its recurrence as well. And this is the common term that we use is the apple shape versus the pear shape, are the two things that you'll hear about the most. Although we also talk about hourglass and rectangle shape sometimes. But excess fat around your belly, it's called visceral fat, it's sort of in between your intestines, is that apple shape. And this is more common among men than it is women, but there is a good deal of overlap of whether men and women have the apple shape. That is unfortunately visceral fat, belly fat, is the most risky for health and for cancer and recurrence and heart disease and diabetes. The pear shape, we may not like the way it looks so much, but it is far healthier than compared to the apple shape. So this is sort of the lower body, and it's sometimes called the female pattern, the gynecoid pattern, or again, although again, there's overlap. There are men that have more of a pear shape, but it is probably more common in women. And this is with less abdominal fat and sort of bigger hips, thighs, and rear end. And that is kind of a long-term storage place for fat. It is drawn upon with much greater difficulty than getting rid of belly fat. When you lose weight, you may find that your belly shrinks and your hips don't, and that is hormonally driven to a certain extent. It is felt that this is a long-term storage fat, in particular in women who may draw upon it when they are pregnant and breastfeeding. And I think we can go on. Next slide, please. A little bit about blood sugar, because this is also a risk factor for cancers recurrence. Overweight and obesity are the leading risk factors for diabetes and high blood sugar. High insulin levels also occur typically, at least in type 2 diabetes, the adult onset kind of diabetes, where insulin, which is supposed to handle blood sugar, is at high levels because your body is telling you you need to get rid of that extra sugar. Let's produce more insulin to get it out of your bloodstream. But unfortunately, high blood sugar and high insulin levels are also associated with cell growth, cell proliferation, and progression of tumors. The cut points for people with diabetes, you try to keep the hemoglobin A1C level, which is a long-term blood sugar, unlike blood glucose. And you try to keep those levels below 7 gram percent. And if it is more than that level, it is associated with, there's that 68% again, a 68% higher risk of cancer recurrence. And this may be particularly true of cancers of the breast, lung, and pancreas. So, in general, though, for cancer recurrence, it is prudent to keep your blood sugar in good control. And some of the ways to do that through diet are through high fiber diets. And you may have heard of the glycemic index, how quickly blood sugar and other carbohydrates get into your bloodstream is reflected in the glycemic index, and highly processed carbohydrates get into your bloodstream basically quicker and cause big spikes in blood sugar, and consequently can also cause hypoglycemia, low blood sugar, and the symptoms of that pretty quickly after you eat. Next slide, please. I just want to mention before turning it over to Dr. Davis, because this is frequently asked by cancer patients, and in fact, many providers, healthcare providers, and surgeons, would rather not have super thin cancer patients. So, what about problems with being too thin after a cancer diagnosis? The reality is that this is really only an issue for people at advanced stages with metastatic, incurable, progressive cancers, where having a little extra body weight may slightly extend lifespan as you are wasting away through anorexia and sarcopenia, losing muscle mass. So if you start at a slightly higher weight, maybe, I hate to put numbers on it, but you may last an extra month or two. But with that exception, for those of you who are in presumed remission and looking to avoid recurrence, there is no problem with being thinner, and it is certainly far better than being heavier. As you saw, the risk of recurrence and even getting cancer in the first place is very closely tied to overweight and obesity. So, not being in those categories is a good thing. And with that, I'd like to turn it over to Lisa Davis to get into the nitty gritty of what you should be doing with your diet and physical activity. And my apologies, I've got another meeting soon after this, so I'm going to sign off in a little bit. Thank you, everyone.
Thanks. Amy, could you advance the slide, please? So as Dr. Cheskin was talking about having too much body fat and high blood sugar as being markers of inflammation, some of the things that we do in terms of lifestyle also are inflammatory. So we're going to talk about some of those dietary factors and how physical activity can also play a role. Yes, thank you. So there's some inflammatory dietary factors linked to an increased risk. As Dr. Cheskin sort of alluded to, having a high glycemic diet, where it's a diet of simple sugars that impact blood sugar to the greatest, and there's a very steep spike in blood sugar levels, often followed by a trough that comes from having, a lot of sugar found in sweetened beverages, in refined carbohydrates, anything that's white, not brown, such as in bread or rice. Those types of foods tend to break down really quickly in your bloodstream into simple sugars that have this high glycemic load, and they are inflammatory. And they contribute to that A1C level that can rise. The higher and higher, the more inflammatory one's state is. So you can reduce your risk by increasing your fiber level, and we'll get to that when we talk about how to address this situation in a few slides. I'm sorry. Could you just go back? Yeah, thanks. So, yeah. So high sugar diet, one thing to avoid. The second thing would be a high fat diet. So we all know there's healthy fats, and those are good things to have in your diet. All the omega-3s and monounsaturated fats that come from nuts and avocados, and we'll talk about them. Those are good, but there are fats that are inflammatory. They're pro-inflammatory. They come from a lot of trans fats and saturated fats in our diet, which are found in a lot of processed foods, fried foods, and meats. They are inflammatory, and our current sort of lack of omega-3s in our diet has us in a pro-inflammatory sort of composition as a whole, where generally the ideal ratio of omega-3 fats to other fats is like 3 to 4 to 1, and we are like 18 to 1. So we're really like very far skewed in terms of how many pro-inflammatory fats we're putting into our diet and how few anti-inflammatory fats we're putting into our diet. The other thing is red meat and processed meat from a different angle. They're through the way that they're preserved, the salt. These things, even vegetables like pickles and pickled vegetables, can be inflammatory, especially for gastric cancer recurrence. So it's just something to be aware of, that some of these preserved foods are also, the way that they are preserved can be harmful. You can advance the slide, please. This ties into grilled and charcoaled meats. So the way that, if you really like your steak well done on the grill with all the char, all that char can actually contain carcinogenic chemicals like AGEs, which are advanced glycation end products, and acrylamide. These are linked to cancer. And so it's best to try and reduce our exposure to these things, particularly to reduce our risk of recurrence. So limiting fried foods and heavily browned foods will help with that. Overeating, believe it or not, causes this physical damage and strain in our stomach lining, which may increase our recurrence risk. So if there's a behavioral issue where we're overeating that might be related to our BMI being 30 or 40 or higher, that's something to actually think about. And then vitamin D deficiency. So many of us, especially in this area, because in Baltimore, our latitude is, we don't make vitamin D between October and April. And so many of us are vitamin D deficient because of that. Also, if we have darker skin, we're about 5 or 5.5 times, we have 5 or 5.5 times less the ability to produce vitamin D in our skin. So it's something to consider, and it's linked to a higher recurrence of cancer and mortality. Next slide, please. So what can we do about this? And that's what I'm thrilled to be here, to be able to just share with you some evidence-informed nutrition strategies that can really help you and to help enhance long-term survival. Are filling your plate with nutrient-dense fruits and vegetables, beans and nuts, and healthy fats like canola oils, olive oils, and lean protein sources that don't contain a lot of unhealthy fats or charred products can really help to reduce the risk of many cancers as well as their recurrence. Why? Fruits and vegetables contain a lot of phytochemicals. Fancy word for antioxidants. There's hundreds of different antioxidants, and they're found in a wide range of different vegetable and fruit products. And these antioxidants help to reduce inflammation, and they help to capture and negate free radicals in the body, which are cancer-causing chemicals. So for example, many of you are probably familiar with tomatoes containing lycopene, and vitamin C, which is another antioxidant that helps to reduce the risk of gastric cancer. Next slide, please. So you may have heard of the rainbow of colors when it comes to fruits and vegetables. That's the goal, eat the rainbow. And that's because all of the different fruits and vegetables contain different sorts of antioxidants, all of which are beneficial in preventing cancer recurrence. So the red vegetables contain things that the purple vegetables don't contain. And it's probably nature's way of ensuring that we have a wide range of different nutrients from a wide range of different sources in our diet. So the goal would be to aim for a minimum of 2.5 cups of vegetables and fruits a day, with a goal of at least 4.5 cups or more. They provide dietary fiber, which can be very helpful for anybody who's had gastric surgery and the rerouting of your systems or anything, or is suffering from constipation as a result. So men, 30 grams a day is the recommendation if you're over 50. And for women, it's 21 grams per day if you're over 50. It's a little higher than that for younger folks. But as well as they provide a wide range of antioxidants, which is really a very important factor when it comes to cancer risk. Next slide, please. So the red vegetables or fruits like tomatoes and peppers and raspberries, they contain the lycopene, which helps prevent cancer, especially prostate cancer. There's a lot of evidence, as well as is heart healthy. The orange contains beta carotene, which has a lot of immune properties, and can be found in carrots and sweet potatoes and all sorts of fruits that contain that are orange, like cantaloupe and apricots. The yellows are more like your lemons and your grapefruits, and yellow peppers containing a lot of vitamin C, which is important for immune health. Green, of course, is very important. Folate, lutein, this is very important for eye health, also cancer. A lot of green vegetables, especially in the broccoli category, contain sulforaphane or glucoraphanin. It's a very hard to pronounce, but important chemical that has a lot of evidence behind it in preventing cancer. So the more of broccoli and cauliflower and Brussels sprouts that you eat, the better. The blue, which would be all your berries. So the flavonoids are a different kind of antioxidant. They're a kind of anthocyanin that helps to prevent cancer. It helps with heart disease. And then the purples. Many of you may be familiar with resveratrol. It's been shown to extend lifespan. So it's been touted a lot. It's been put into supplement form even. It's found in red wine. So a lot of our berries and our grapes contain that, and it's very helpful for heart protection as well as cancer protection and reducing inflammation. And even our white and brown vegetables, such as onions and cauliflower and mushrooms, contain important antioxidants like quercetin and the indoles that are cancer protective. So the important thing to note is that they all do a little bit of a different function. And so it's important to get all of these different fruits and vegetables into the diet so that you really are having the full rainbow of colors. Next slide, please. So what should your plate look like? There's a lot of different plates out there. There's a diabetes plate. There's the kidney function. There's a many plates, but there is a plate for cancer survivors. So it's an anti-inflammatory plate made up of mostly fruits and vegetables, whole grains and beans. Looks a lot like this picture. Choosing healthy proteins, lean proteins that do not contain a lot of unhealthy fat, that are not grilled and charred, that provide lean protein, which is really important, especially during this time, as well as you consider other plant-based sources of protein, such as beans and peas and tofu, which are a great source of usually protein and fiber. And to have that instead of meat multiple times a week, ideally. Staying hydrated is really important as well, because sometimes constipation can be a problem. And so especially when you're eating a lot more fiber than maybe the standard American would, because you're now having a lot of fruits and vegetables, which provide all these antioxidants, you want to be able to stay well hydrated and keep everything moving through your digestive tract optimally. Next slide. So there's a little challenge you could do with yourself, or maybe even with your family, where you do a 7-day challenge. It's called Eat the Rainbow Challenge. You may have heard of this or tried it even. but it's a good way to start sampling different fruits and vegetables that you can incorporate into your diet, and in doing so, you're achieving your dietary goals of getting the antioxidants in that you need to in all the different ranges that these provide. Next slide. So Dr. Cheskin talked about sugar and diabetes and the high impact of having hyperglycemia or high blood sugar level on your cancer state. So the link seems to be indirect. It's not. There's a lot. I know there's a lot of question mark in this area. There is some, at least theoretical evidence that sugar stimulates the production of cancer cells. But there's a much more obvious and indirect link between sugar and cancer, and that's because it creates obesity. So eating too much sugar over time increases our rates of obesity, which increase our rates of diabetes, and that is what sets you up for having cancer. There's not really any definitive evidence at this time that sugar itself causes cancer. But we can all reduce our risk of getting cancer by lowering the amount of free sugar in our diet to help maintain a healthy body weight. So again, that's limiting simple sources of sugar from having regular soda or adding a teaspoon of sugar into our tea, or just having saltine crackers or any other white bread, anything like that. These are simple sugars that should be replaced by ideally whole grain bread, oatmeal, things that are brown. There is a question had come in about honey, and we'll talk about that. I think it might be the next slide. Maybe it is. Could you advance the slide, please? Well, it's not, but we'll get there. Let's talk about limiting sugar. So again, if you can, I know when you have cancer, you're probably thinking, well, gee, is it really a good idea that I have like these non-nutritive sweeteners? Aren't they linked to cancer? But honestly, there's no evidence to speak to that, and there is a lot of evidence to speak to this link between sugar and obesity and cancer. So it is better that you choose Coke Zero over a regular Coke. So having 0-calorie beverages would be the best. And if you are uncomfortable with that for whatever reason, there's plenty of seltzers or just plain water or tea that's very helpful. Tea and coffee both contain a lot of chemicals that that are protective. There's EGCG and all sorts of catechins in tea, which are antioxidants that, especially in green tea, that are cancer protective. Same thing with coffee and colon cancer. A goal would be to keep your added sugars less than 10% of your calories. Well, what is that? I think that's hard to determine sometimes. So if you want to pay attention to food labels, that would be keeping your sugar grams less than 50 grams a day. I think it's always an interesting exercise to tally up what you're actually consuming in a day by tracking. I think it always is eye-opening and surprising because there's so many sources of sugar in our diet that we don't even realize, from tomato sauce to ketchup. So 50 grams a day would be really the cut point, but the ideal amount of sugar, and I tell this to my pregnant ladies, is 25 grams a day, which is it's about 6 or 7 teaspoons of sugar a day all together, not added. I mean, in everything that you eat in a day. So there's 4 grams of sugar in a teaspoon or in a sugar cube. So really we're talking about 6 or 7 teaspoons of sugar a day would be the ideal in everything that you eat, not added teaspoons. We can do this by limiting highly processed foods, refined grain products, those white products I was talking about, and replacing them with complex carbs that are brown. Next slide. So this is the slide about the honey. So even though honey is a natural sugar, it is still an added sugar. It falls into the same category as sugar cubes and other simple sugars like juices and sodas. Um, so it is, I would not say to avoid anything that you love and really it's important to you to have in your diet. I think a better approach is to fit it into your budget. So if your teaspoons, if you can fit honey into the 25 to 50 grams of sugar a day allotment that is probably ideal for you, then I would say to go ahead and have that. Natural sugar comes from fresh fruits and vegetables, as well as nuts and seeds and milk and yogurts and grains. Um, they're not very sweet, but those are our natural sugars. And when they're digested, they're much more low glycemic. They don't have the same glycemic impact on our blood sugar level. It takes them a lot longer to be digested and absorbed by the body than simple sugars, which go right into the bloodstream and send our blood sugars soaring. Next slide, please. So a couple questions came in about a keto or a calorie restricted diet, which is a great question. And I think from a theoretical standpoint, it makes perfect sense. There's something called the Warburg effect, where normal cells produce energy via a different metabolism than cancer cells do. Cancer cells usually are involving a pathway of metabolism that involves a lot of glucose from dietary carbohydrates, whereas your normal cells are much more functioning using your mitochondria, which is a different kind of metabolic pathway. And so, yeah, theoretically, it would make sense that you might want to reduce glucose and carbohydrates because of this potential, pathway. And again, there isn't any direct evidence of that. I think it theoretically makes sense. You could hedge your bets, but we're still, kind of early on in building our data, and evidence for this. So I guess stay tuned. But we do know that from a review that the ketogenic diet has shown an anti-cancer impact, at least in animal trials and some smaller clinical investigations, where a ketogenic diet is sort of a high-fat diet that limits carbohydrates, especially simple carbohydrates, to a significantly low level. And it focuses on healthy fats and proteins. And there is some evidence that this is actually helpful. But unfortunately, despite the favorable findings, the evidence is still preliminary. So it's something to, I guess, keep in your back pocket, and maybe have certainly the focus on, getting your healthy fats and your lean protein sources, and be very mindful to have your complex carbohydrates being the main kind of carbohydrates you're putting into your diet, and really limiting those simple sugars, but maybe not necessarily to the very stringent and strict level of the keto diet. But please do discuss what diet is right for you with your doctor or your own registered dietitian. So one other area that I think you might find very surprising is the incredible impact physical activity can have on your cancer recurrence and reduction of it. Do you advance the slide, please? So at the bottom line, when it comes to physical activity, is the more the better for survival. I mean, the effective dose that the American Cancer Society says is 150 to 300 minutes per week of moderate intensity physical activity. That seems like a lot for most people, whether you have cancer or not. But it really seems in most of the research that's been done to have the most favorable effects, whether you have early stage cancer or even later stage cancers. So it's very a very significant impact. And it may be that it helps to regulate insulin sensitivity. And again, if it's helping you to reduce your weight and reduce your blood glucose level, it helps to reduce the inflammation that's produced as a result and enhances your immune response, even your gut microbiome. So the more exercise, the better within your ability to tolerate it. Um, Again, this is a lot of cardio exercise with a couple days a week focused on strength training, of course. But it seems to also really have a favorable effect on quality of life as well, which is really important. Slide. So there is, as I said, this consistent evidence that physical activity reduces the risk of gastric and colon cancer and improves survival, even those with later stage cancers. And, we're talking to be 3 to 5 years out or, greater compared to sedentary patients that their cancer recurrence is at bay. So I guess the caveat to that would be advanced stage pancreatic carcinomas, because unfortunately that's a pretty short-term diagnosis. And so it's really hard to study that. And so there's very limited data. But in general, exercise, as I said, improves quality of life and symptoms for many people throughout the different stages of cancer. Improves fatigue, bone health, sleep, heart, and psychological well-being as well. Next slide. So supplementation, I think, is a big question mark. So there is research that's found that taking supplements is not necessarily as effective as eating, vitamins, minerals, and antioxidants from food themselves. And in fact, sometimes supplements can be just harmful or interact with your cancer treatments or other medications. However, there are other times where it can be helpful, especially if you can't eat that much. And so you're not getting a wide range of vitamins, minerals, and antioxidants in your diet. But this is something, again, to talk to your healthcare team about, because there are different cancer treatments that you may be receiving. There's medication like blood thinners and others that it can potentially interact with. Next slide. So I think there are some safe supplements to consider. As I mentioned, vitamin D. Most people are vitamin D deficient, and most people have their vitamin D levels checked now. So if you know yours, or if you don't, this is something to ask your doctor. It is really important for your immune function. So it is a number that's important to know. And you can simply supplement very easily vitamin D. A multivitamin is also generally recommended, especially if you're not able to get the intake that, you would have been able to because you just can't eat that much, or other factors. And protein shakes, because protein is very important for maintaining your lean muscle mass. And so I usually try to tell patients to get at least 30 grams of protein per meal, whether breakfast, lunch, and dinner time. And ideally plant-based sources of protein for the anti-inflammatory plate. But that would be a good goal for each meal, is 30 grams of protein. And there's plenty of different protein shakes out there, many of which are made with plant-based proteins now. Not that you can't have whey protein, that's fine too. But again, there are some health benefits to having plant-based protein. I also wanted to talk about probiotics, because many of you may be thinking about them or even taking them. So there's a lot of promise with probiotics, and there's a lot of research out there. It's just that there's so many different probiotics out there that the clinical evidence remains sort of limited. Now, probiotics are the healthy bacteria that grow in our gut. They come from the fiber that we eat. And so the fiber is sort of the food for probiotics. So a lot of fruits and vegetables are the sort of material for probiotics to feed on. And so fruits and vegetables are this anti-inflammatory fiber that probiotics feed on. And that's the kind of bacteria they generate in your gut, which is helpful. Next slide, please. So probiotics are generally safe and beneficial after HIPEC to restore gut flora that could be disrupted by surgery, chemotherapy, all the things. They can help reduce infections because they improve immunity, and they help to repopulate that healthy gut bacteria, can help to manage your diarrhea. Again, there are food-based sources of or dietary sources of probiotics that are ideal. So yogurt and kefir, fermented foods like sauerkraut and kimchi are definitely sources. There's Activia yogurt that actually contains live strains of, of probiotics. So there, there are two main safe probiotics to take, because literally there's hundreds of them now. But the Lactobacillus acidophilus, which populates your small bowel, that is what's found in yogurt. It is probably a very safe supplement to take and helpful. It's a probiotic. And bifidobacteria, which populates your lower bowel, your colon, is also one that is safe. But definitely do talk to your oncologist or dietitian before starting probiotics, because again, they can interact with certain treatments that you may have if you're getting them outside of just food sources. Next slide. So the other thing that you may or may not be aware of is that physical activity not only is helpful for our heart and production of cancer, it actually helps to increase our healthy gut flora. And when you think about it, it really makes sense why. We do this in our physical activity. It helps to reduce our insulin levels and our blood sugar levels, which helps to dampen that inflammation, helps, which allows our immune activation to kick in and regulate our microbiota, which are the flora in our digestive tract. So the higher the quality nutrition that you have with fruits and vegetables and whole grains and fibers of those kinds, the more microbial diversity you have. That's actually a good thing. And those have anti-inflammatory effects. And so, as it turns out, through this mechanism as well, exercise is helping extend cancer survivorship by improving gut flora. Next slide. Does anybody have any questions? That was a lot of nutrition and exercise to talk.
Let me stop the sharing and remind everyone that we have a question and answer button. I do see a few in the chat. Living in the north makes it difficult to get a variety of vegetables in the winter. Are canned or frozen a good alternative? And then low sodium canned.
I think they're a great alternative. I mean, you do the best with what you've got. You know, there are a lot of certainly getting fruits and vegetables as fresh as possible have a lot of benefits. However, you know, canned vegetables and frozen vegetables do as well, especially frozen vegetables. And sometimes, in some cases, frozen vegetables can be even better sources. So, you know, low sodium, yes, that would be the optimal choice, because you know, sodium may be impacting your blood pressure or heart disease or any of the other factors. And extra sodium, well, I don't think it's very well studied. If it's helping to preserve, you know, meats and different things, I can't imagine that it's a good thing for the cancer recurrence either. So yes, low sodium makes sense.
Lisa, another question. What about fresh fruits with short bowel syndrome?
I mean, I think you do what you can tolerate, and maybe if you're having trouble digesting, you know, you take them in whatever format that you can in small servings, and maybe small frequent servings is the best way to do that. And honestly, more importantly is vegetables than I would say even fruits are. Another workaround might be to add the greens to your protein shake. You have all the little green packs now that provide all of the vitamins, minerals, and antioxidants you would get in fruits and vegetables in powder form. And you can put that into your smoothie. That might be a way.
Okay. Would you say the name of the two probiotics?
So
Remind.
Lactobacillus acidophilus is the main healthy bacteria that you would find in your small bowel. And bifidobacteria bifidus is the main bacteria that you normally find that's healthy in your colon or your lower digestive tract.
Okay. I have several questions. I live alone and wasting food can be a problem. Are there any meal delivery services that you might recommend?
Yeah, I mean, so purple carrot would be one. I used to be part of one, but it's no longer in existence, so I would have recommended that. But any one that really focuses more on healthy fruits and vegetables, I would recommend that. Like, and purple carrot would be that. Definitely, I know purple carrot is one of those that is, plant-based. So a plant-based diet would be best.
Okay. Do you have thoughts on sourdough bread?
Yeah, I think sourdough bread is fine and good. It's definitely good for the gut. And it helps also to you know, it contains prebiotics and little probiotics and helps to in its way um help with digestion if you're, a person that can't really tolerate gluten breads and whatnot. But yet you really do like bread, that's another way to get it in. Um, so I would say sourdough bread is a great addition if you can have that in your diet. Yes.
Okay. Can you comment on the importance of washing fruits and vegetables before consumption and what is the best way to do it?
Yeah. So unfortunately, unless you are buying organic, which would be the ideal way in this particular setting to get fruits and vegetables, I would use one of those vegetable sprays and clean them readily and make sure that they are thoroughly washed before consuming them because of the pesticides and herbicides that are linked to cancers. So it's a big concern. Ideally, you're getting products that are organic and non-GMO. Um, it, especially for a cancer patient. It's less important, I think, for other people maybe that don't have cancers per se, but I do think that buying organic, if you can, is really helpful for people with cancer or who are survivors of cancer.
Okay. Um, Let me see. I have another question here. Um, can you talk about fasting and the efficacy and protocols involved?
Yes. So this falls along the line of the keto diet is in terms of like the evidence that's out there. I think there is starting to emerge some evidence in cancer patients about fasting, but again, it's a lot more theoretical um, in terms of starving nutrients and whatnot. In general, I think fasting is a good idea. I think that our bodies need a reset. That's why we ideally are not eating after 7 o'clock at night. We have all night to like recycle all the junk we put in our body during the day, let our cells get cleaned out and start again. It helps with our circadian rhythm and everything and our sleep, all those things which in fact can impact our stress level. So I do think fasting is a good idea, at least like a 12-hour fast. like, have breakfast the next morning to break the fast. So like 12 hours. Outside of that, I think that we can't say yet. And my concern would be that, there's, is the downside to that. I don't want anybody not to get enough nourishment because they've limited the window that they're eating. So it's really a fine balancing act. And I think that this is something you would have to really work with your doctor and dietitian, personal dietitian on.
We did have a comment that someone shared that Green Chef is also another healthy food delivery service that might be recommended. And I also believe Hungry Root
Yes, yeah, that's
also is one of those food delivery services. And I have one last question. I know we're slightly over time, but how can you use diet to help side effects of stress?
so, stress, of course, increases our cortisol levels, which increases our blood sugar levels, which increases our inflammation. And so, if you can quell some of the inflammation that's being produced in your body, that can help. I think there's, following a low glycemic index diet and not adding more fuel to the fire, so to speak. So low sugar, lots of fruit and vegetables, things that don't add physiologic stress onto your stress can be very helpful. So just eating the anti-inflammatory diet alone can be one way to help manage the stress to the body, because it is a stress to the body to add to try and digest unhealthy fats and deal with all these other chemicals that are a natural byproduct of the foods that we eat. So sort of being very conscious about what we put into our body in terms of our diet is extremely important in managing our stress levels. So the B vitamins also, so making sure that your B vitamins are adequate is one, they're called the stress vitamins, the B complex stress vitamins is something. So if you have a multivitamin and you want to take a multivitamin with, B complex, that could help too.
Perfect. Well, Lisa, thank you so much for joining us. I don't have any additional questions from our chat, but this was a wonderful session. I appreciate your time and for everyone who took the time to join us today. We are planning on an additional webinar in April on ostomies and ostomy care. There'll be more information about that put out soon on our socials and on our webpage. Today's recording will be posted by the end of the week on our webpage and also shared out on our socials. I appreciate everyone joining us and have a good afternoon.
Thank you.